Hello, my name is Ireland, and I'm doing the types of dysarthria, and this is shock number 6. So for the different types, we have unilateral upper motor neuron, spastic, flaccid, mixed, hyperkinetic, and hypokinetic. Um, we're going to be looking at the causes, signs and symptoms, and then the speech and all the parts of speech. So for the first one, you're going to have unilateral upper motor neuron, and you can see like the paralysis up there and the pictures of the vocal folds. It's pretty interesting. But the causes are a CVA or a stroke, which same thing. And some signs and symptoms. It can be mild or transitory and transitory. The speech is usually mild to moderate in severity. And for the articulation, it is imprecise, harsh, and hypernasal. For the swallowing, it's a laryngeal penetration and silent aspirations. So not really good there. Next one is spastic dysarthria. And the causes could be stroke, a TBI, a tumor, infection, any degenerate diseases, and any other damage to that nerve. Some signs and symptoms, you have really strained voice quality and you're really a slow speaking rate. You have alternating motion between rates and slow and normal. Your speech, your phonation is going to be very hard, strained grunting. You're going to have low pitch breaks, monoloudness, and decreased stress. Resonance is going to be hypernasality. Articulation is going to be very imprecise. You're going to have disordered vowels and constant errors. Your prosody, it's going to be the onset of hyperadduction. So it's going to be increased speech rate. So you're going to be talking really fast. For swallowing, you're going to have dysphagia, have trouble swallowing, but you want to, and it will be reduced strength in your oral muscles, which will delay the swallow, which will cause incomplete elevation and closure of your muscles in your mouth. So it could cause you to drool, and then chewing and swallowing problems also come with that. So for flaccid dysarthria, some of the causes could be stroke or degenerative diseases. Some signs and symptoms is diplophonia. That's when you can hear two voices whenever one person talks. It's kind of crazy, but you get nasal emission, short phrases, imprecise alternating motion rates, and some other issues to do with the mouth there and speech. Flaccid dysarthria often results from weakness of the soft palate, larynx, and tongue due to the degenerative diseases, and this causes the speech to be thick. So speaking of speech, for your phonation, it's going to be a very monotone speech, a very single loudness, single pitch. For the resonance, it's going to be hypernasal, and then for the articulation, you're going to have really breathy voice, and it's going to be very impaired with imprecise consonants. For your prosody, you're going to just have shortened phrases, and swallowing, you could get some nasal backflow while swallowing, and you're going to be drooling a lot because of this lack of muscle. So for mixed dysarthria, you get a combination of flaccid and spastic dysarthria. Some of the causes are diseases like ALS and MS, which are those degenerative diseases, and then strokes. This is caused by lesions in the cortical motor face area in the cerebellum, your brainstem, or your cranial nerves of the innervation of muscles for articulation. So lesions in the nerves. Signs and symptoms, it can be difficult in controlling the tongue and lips. You can have a slurred or indistinct speech, and it might be uneven vocal patterns. For the speech specifically, for your resonance, it's going to be uncontrolled vocal volume. For articulation, it's going to be speech intelligibility is not going to be very good. Prosody is going to be very slow or very rapid speech, not really normal. And then you're, of course, going to have dysphagia with swallowing. For hyperkinetic, you're going to have causes are like a pathological tremor and an essential tremor. This could be like a vocal tremor, maybe accompanied with tremors of other parts of the body. Some signs and symptoms could be modulated voice and speech, vocal arrests like spasmodic dysphonia. For speech, phonation, you're going to have pitch breaks. Resonance, you're going to have single strangled harshness. Articulation, you're going to have low pitch, monotone. Prosody, it's going to be very choppy speech just because they're having those pitch breaks. And vocal arrests. And then swallowing, you're going to have difficulty doing that as well. Hypokinetic, some of the causes are the disease of or trauma to the basal ganglia control circuit or prolonged immobilization. Some signs and symptoms can be difficulty starting sentences, difficulty for loud speaking, and strained in hypernasality. For the phonation, you're going to have issues with plosives, affricates, and fricatives. They're most affected. Resonance, it's going to be very quiet. Your articulation is going to be monotone and very breathy. So it's just real light sounding and breathy. For your prosody, you may stutter or have slurred speech. And then swallowing, you can drool and will probably have problems swallowing with as dysphagia. All right, that's it. And thanks for watching.